Good evening, and how are you? Thank you so much for making time for This Is the Day, and I hope you're keeping safe and also keeping your distance as the world tries to tame the COVID-19 coronavirus, as we would like to call it, to tame it. And this is a virus that has almost brought the entire world to its knees. My name is Sarah Otieno, and we're just getting started on This Is the Day. The WhatsApp number that you can use to contact us from is 0786 316 316, SMS line 20316, and let us get to know how the numbers look. Now, globally, the numbers continue to rise as the days go by. Now, this is how the numbers look globally. At the moment, we have 2,586,365 cases that have been reported across the globe. And out of that, we have 179,933 deaths. But there is hope. We have recovered cases of up to 705,814, and that is good news because the recovered cases are more than the deaths in the country. But now let us look at some of the specific countries that are topping the list when it comes to the worst infections and also the deaths. There is the United States of America that has reported new cases today of 1,385. That is in the last 24 hours. And we also have Spain that has reported 4,211 new cases today. We also have other countries like Iran that has 1,194, and we have the UK that has 4,451 new cases reported today. Now, that is globally, and just looking at some of the countries that have recorded the highest cases in the last 24 hours. Now, let us come back home. And in our country today, in the last 24 hours, they tested 707 samples, and out of that, 7 turned positive. And as the CS for Health Mutahi Kagwe was saying, the total number now stands at 303. Listen in.
Today, having tested 707 samples, we have 7 persons who have tested positive to the disease. Those being Kenyans as a whole. We don't have any foreigners in those figures. And I would like to state, kama vile nilisema, hii ugonjwa si ugonjwa wa serikali, hii ni ugonjwa wa kila mtu. Na kama mjuavyo, kuna wale ambao hawaogopi, na yule ambao haogopi atakuja kuogopa, kwa sababu hii ugonjwa haina tajiri, haishagui tajiri, haishagui kijana, haishagui yoyote. Kila mtu anaweza kushikwa na hii ugonjwa.
Well, though that is the information from the CS of Health Mutahi Kagwe, who said this disease, it does not choose. Anyone is viable, and that is something that we should be on the lookout for. Now, for the last 2 weeks, 4 counties in our country, that is Nairobi, Mombasa, Kilifi, and Kwale, have been on a cessation. That means there is a partial lockdown. There is no movement in and out of these 4 counties. But today, Mandera County added to the list of these counties, and now it is the 5th county to be noted and put under the cessation movement. This is a result of the rising cases in Mandera County, and this is what the CS had to say about it.
Today, we have looked at the unfolding situation in Mandera County. So far, the county has 8 cases, 2 cases of urban refugees. Now, this is a dangerous situation because, as you are well aware, Mandera has a lot of is a corner county with neighbors on 2 sides, and is also affected by travel from other parts of the country. Therefore, as part of the containment measures, the government has today directed restriction of movement into and out of Mandera County. The county, therefore,
Well, Mandera
becomes
County
the
is
fifth county
now part
where
of the
movement
counties
has been
that
restricted.
movement is not allowed in and out of those counties. And also, as people are at home and you are not going to work, there has been raising concerns over the mental state and mental health cases related to this pandemic. And the CS for Health, Mutahi Kagwe, pointed out that as a government, they have been concerned. And for that reason, they have identified and developed a unit for psychiatric uses and also for psychological purposes. And he says there is a number that you can dial anytime you feel like you're mentally disturbed resulting to this pandemic, the COVID-19 virus.
Gentlemen, fellow Kenyans, in times such as this, we have to be alive to the effect that COVID-19 management measures, what these measures have had on our people. We are particularly concerned about mental health. Towards this end, we have established a psychiatric and psychological care help framework over this period. If you feel distressed and needing counseling or psychological care, please call 1199 and you will be attended to. For any inquiries on continuity of psychological care or psychiatric emergencies or crises, please call our hotline, which will be distributed to the media.
Well, that number is an additional of the various numbers that have been put out to the public as hotline numbers that you can reach for help. And for mental cases, 1199 is the number that you can always dial to get some help. Now, we have seen cases and we've had and seen videos of people escaping from the quarantine facilities. Now, this has raised a concern even for the Ministry of Health, as they are saying those who are leaving the quarantine facilities without undergoing the mandatory testing and being ruled out to be negative by the health department are the ones that are putting other people at risk. The CS for Health says these people, as they leave the quarantine facilities, they stand a chance of infecting other people in the communities, now increasing the number of community infections that are currently being reported across the country.
Wale ambao hawafuati, wale ambao mnaona wakiruka, wakitoka kwa quarantine facilities, hao watu ni kusema wanataka kutoka huko waingie vijijini wapeleke ugonjwa huko vijijini. Ukiona mtu akiruka ni vile mnajua wale wengine walifanya. Mnajua kuna watu walienda mazichi upande wa Malindi kule Kilifi, ugonjwa ukaanza. Wengine wakaenda mikutano, ugonjwa ukaanza. Hapa Isili tulikuwa na imam, alikuwa hajui yeye ni mgonjwa, akaja akafariki. Wale ambao walikuwa na yeye karibu wamepata hii ugonjwa. Kawangware iko watu wengi, walianza na mtu moja, wakaenda 3, wakaenda wengine 2, na tunaendelea kufanya testing huko tuone ni wangapi pengine. Ukiangalia kule Mombasa upande wa KPA vile hii ugonjwa inaendelea kuchika watu. Kwa hivyo jameni, mimi ningewasihi wa Kenya tusije tukasikiliza wale ambao ni lazima waseme mambo mambaya.
Well, it is only right, even by the law, to make sure that we adhere to the instructions. And if you are in the quarantine facilities, it's only right that you adhere also to the measures that have been put by the government and the ministry for testing and ruling out of these cases. We are live on This Is The Day, live on Family TV, also live on Family Radio. And thank you so much for making time today. Lynette, asante sana for tuning in today. And they're saying, by the way, those that left KMTC, I pray they go back and be responsible to the society. Thank you so much for tuning in. And I can also see Fred Owino kutoka Kisumu. Thank you for tuning in today. Remember, the WhatsApp number that you can use and join our discussion is 0786 316 316. SMS line 20316. Now, different counties are taking and putting in place different measures to help curb the spread of COVID-19, even in the counties. Well, today there has been a partial lockdown in Mandera County, but we have other counties like Kilifi County, where the governor, Amason Kingi, has now decided that those who are flaunting the rules of curfew will be arrested and taken to forceful quarantine that they will guarantee and pay for by themselves. And he says this is just to discipline some of those people who have refused to follow the rules that have been put by the Ministry of Health and also the government of Kenya.
Kwa hivyo wako hapo polisi, tutawatoa leo. Tumewaandalia pahali ambao tutawashika pale kwa siku 14. Baada ya hapo tutawapima, alafu ndo waachilie. Iwe lile funzo la watu wengine ambao watatoka. Virusi hivi vinapatikana wakati watu wanatangamana katika halaiki kubwa. Na tumesema kwamba hatutaki watu watangamane katika halaiki kubwa. Lakini hilo kwa wengine linaingia upande huu na linatoka upande ule.
So we are ensuring the fraternity, the agencies working inside, our stakeholders, that it is safe to come into the port, as all the cargo ships are coming in are quite safe, and with this testing we'll be able to know the trend of how we are doing.
We're taking the measure to ensure that everybody is tested, and all our workers we are testing today. We are starting with the confectional cargo operations. Tomorrow we will do also the security and also container terminal operations. Those are the key areas where we cannot stop operations because the port works 24/7.
Well, Kilifi is amongst the counties that have been put on partial lockdown. Well, that is a good move, and it's also happening across the country and even in Nairobi. Yesterday, we did a story of 455 people who have been arrested and put on forceful quarantine because of flaunting the curfew rule. Brings us to one reasoning. We all need to adhere to these measures if we do not want to be found on the wrong side of the law. Now, different people came together, and in Kenya we had a group of people who came together to make ventilators. And right now the Kenyan-made ventilators have passed the standards of the Kenya Bureau of Standards. And according to the representatives, they're saying this ventilators are made locally with local materials, and they're made by Kenyans. The industrialization CS Betty Maina had this to say.
As we have angered about what else to do with our industry, the idea of going into new lines has been mooted, and it's part of our plan. But now when we see industries coming forth to actually start to go into those areas, then it shows that at least the plan is in the right direction. And
this crisis has been one of those moments where, as a nation, we've come together to realize that it's important to have local content, it's important to have local industries, and there's no turning back.
I certainly hope that after the height of the pandemic is over, whenever that will be, that we shall not forget our innovativeness, and we will actually take some of these ideas to full commercial production and explore new areas of business.
Well, having passed the standards that have been put by Kenya Bureau of Standards, they're now waiting for the Ministry of Health to approve these ventilators, and this will be happening in the next couple of days, and we wish for the best because we need it right now. Now, the Chief Justice David Maraga has talked about the issue of open courts that has been ongoing for quite some time. Now, he says these open courts will be suspended indefinitely until further notice. And the reason as to why this decision was reached upon is the fact that court sessions have been identified as one of the areas where the spread of COVID-19 can be done very fast, and also exposing different kind of people, even the elderly. But for now, the CJ is saying that the use of technology should be adopted, and some cases will be solved remotely without people going for court sessions. Listen in.
Taking all these factors into account, we have come to the conclusion that while it is prudent to upscale court activities, it will not be wise to have open court sessions at this time. With these facts in mind, the NCAJ has this morning considered the situation alongside these key factors. Number one, courts are of necessity heavy human traffic establishments which attract people from all walks of life. Court users, including judicial staff, witnesses, and suspects of crime, will invariably come from the very communities where the spread of COVID is said to be increasing. We know that this is affecting the court users a lot, but I'm sure everybody understands the situation in which we are.
Well, that is a good move, and also pointed out by the CJ is that some of the workers, some of the judges are quite elderly, and for that reason, and considering the fact that according to the Ministry of Health and WHO, coronavirus affects more people who are elderly, then these are some of the reasons as to why the open courts have been suspended. Online learning, e-learning, it has been going on for quite some time, and according to the Ministry of Health, most students and pupils and even those in colleges are still accessing their education through e-learning, the use of devices to access their education. Now, this has put the Ministry of Education under fire, and it comes from the Mwingi Central Member of Parliament, Gideon Mulyungi, who says it is not right, and considering the state of different parts of the remote and rural areas in our country, including his area, it is not viable because these people do not have access to electricity and even the gadgets to enable e-learning.
To this moment, nobody has thought of postponing the examinations, the national examinations, both the primary school exams and the secondary school exams. And to the best of the government's ability, the children are getting online learning, as I stated last week.
From the perspective of my constituency and the picture in most parts of the country, this is not happening, and it is a total lie. The CS is speaking from the ivory tower in Nairobi and is not in touch with the reality on the ground. Students in the rural villages and some urban areas cannot afford this imaginary luxury of online teaching during this period of COVID-19 pandemic. He should come to Kitui, visit some families and see how they are doing it in the villages where people don't even have houses. Just visit them there, where people stay in manned houses, some don't even have a shelter, and see the situation on the ground.
When our students go back to school, they might be affected psychologically, having learned that their schools, their items were used by corona patients.
Well, this is clearly something that should be looked into by the Ministry of Health, even the Ministry of Education. And as it was pointed out earlier, and this is maybe a reminder to all the parents and students and pupils, the candidates for this year, there is no communication from the ministry and even from the government that there will be postponing of the national examination. So keep that in mind as you urge your pupils and your children to keep studying. Now, for some time now, we have been having floods across the country. In the western region, in the Rift Valley, we have had cases of landslides and even just floods from the heavy rains that, according to the meteorological department, is not yet to stop anytime soon. Now, the government has developed an interdepartment committee and team that will help to curb the dangers that are coming with the heavy rains. And this involves the ministry, the cabinet secretary, that is the CAs for Interior, Fred Matiang'i, Environmental Cabinet Secretary Keriako Tobiko, and also the Devolution CS Eugene Omalwa. And they are saying they're working together to remove people from areas that are prone to these floods and mudslides to higher levels, and also coordinating on how these people will get relief from the government, including the food reliefs. Listen in.
Please heed the warning. Listen to what the leaders are saying. move to higher and safer grounds. That is our message. Tell clearly from this rain that we are going to have challenges of flooding in some parts of the country. This morning, our Principal Secretary for Interior, Dr. Kibicho, has put out a cable to all county commissioners and regional commissioners in the country to work with Ngao infrastructure across the country to ensure that we move all the populations in mudslide-prone areas to safe places. I am talking about Muranga, Taita Taveta, Elgeyo Marakwet, West Pokot, and we are looking at the counties of Garissa, Tana River, and parts of Kitui, where we are likely to have certain challenges.
On behalf of national government, we have already responded and sent support in terms of food and non-food items to support all the affected families. And we want to assure them and to assure the counties that the national government will continue giving them this support, not just in Elgeyo Marakwet and West Pokot, but in all the counties affected by these floods. We are talking of Kisumu County, we are talking of Busia, at the coast, Tana River. We will continue giving them the necessary support in terms of relief food and non-food items. But we are also urging the counties that with climate change, we will continue having these disasters. They must set aside enough resources in their emergency funds where the law allows them to do that and to able to realign their budgets to address this disaster.
Well, it is important to note that according to the Met Department, we might be experiencing some heavy rains up to the end of the month of May. So let us continue being vigilant. Esi Kimenyi, thank you so much for tuning in today. And also Jen from Nakuru, asante sana. Well, let us go to Migori, where the residents of Migori are jovial. They are very happy because finally they have received free masks from the county government and from the Council of Governors. And according to the chair, Wycliffe Oparanya, he said that 1 million masks have been distributed free of charge to the people of Migori. All this with an aim of curbing the spread of COVID-19 in that area. Listen in.
Hapa hatuna lockdown. Kwa sababu hatuna lockdown, watu wako huru kufanya mambo yao vile inatakikana, lakini wasingatie sheria. Tukifika wakati huo, watu wa huko watakuwa na priority, tutakuwa na priority ya kuona kwamba mpaka wapate chakula. Tumeona ya kwamba tuwatafutie mask, wakiwa kwa soko wao kwa mask. Kwa hivyo wana nafasi ya kutafuta chakula. Lakini tukifika wakati wa kusema tufunge kila mahali, sasa mambo ya chakula itakuwa ya muhimu kabisa, kwa sababu huwezi kuambia watu kaeni nyumbani na hawana chakula ya kula kule nyumbani.
My president, to take a bold step and tell China, since this virus came from you, you've destroyed our economy, we have no money. So we can't pay, and we won't pay. That is what China must hear. Ninaenda na ile module ya Naivas, yani ile ya kudrop chakula. Niko na mask, tuko na mambo ya sabuni, tuko na mitungi ya maji.
Politicization of COVID-19 has recently witnessed through labeling of PPEs, labeling water tanks and sanitizers with the names of public servants who in the first place have purchased those things using public funds.
Well, this comes even in the wake of the county governments and the Council of Governors distributing sanitizers to different parts of the country and the counties. Now, there is a point that has been put across by one Frederick Owino, and he's saying, I don't agree with the CS. There is no harm extending examination date by a month after the pandemic. He lives with a candidate, and he's saying the only thing that the CS can do is that to remind them that they're not on holiday and they should keep learning. Thank you so much for that response, Fred, all the way from Kisumu. Now let's head over to the Senate and what they are doing to cushion these tough economic times for our country. Now, there is a bill that was seeking to cater for Kenyans, and part of the discussions that were being put on that bill is on the issue of rent payment and also tax payment. Well, this bill that was presented by Nairobi Senator Johnson Sakaja under the Department of Pandemic Response and Management Bill 2020, that's the name of the bill. And right now, the senators just want Parliament to pass this faster before times become more hard even for Kenyans.
I want to call upon the National Assembly to quicken the process of passing this legislation, Mr. Speaker, so that we can have a legal framework and that harmonizes ways in which we are going to fight this virus.
It's a virus which is virulent, which can attack, and if it goes to the extreme consequence, it can cause death. That's why you've seen massive deaths in some of these countries where this virus has not been properly controlled. And therefore, we have the with all means as Kenyans to be able to stop this pandemic.
How is this money being spent? When you ask those questions, nobody wants to give you the answer. We are seeing different counties coming up with different plans. I think it is important for all these counties to be coordinated. Someone was asking yesterday, how come Machakos County is able to set up these hospitals in the stadium, and your county is not able to?
Ilibidi tushike watu 200 wakibobea pombe ya mnazi. Kati ya 200 hawa, wawili walikuwa polisi, askari. Na wote wanapeana mrija, unatembea mrija. Hii ni njia moja ya kuita kifo.
Well, people have resorted to desperate ways of making money during these tough times. And remember, the members of the public had 14 days to give their views on this bill. So if you can do it, then it is a good move starting Monday. And up to date, 3 days are gone. So we have about 11 more days to give our views on this issue of the bill that has been passed by the Senate. Well, let us go over to the elderly persons. And during this time, the government set aside some amount of money to take care of the elderly persons and the vulnerable groups. During this time, some of the things that they want done to them is to have their stipend money sent directly to their mobile phones. According to them, it has been done using the bank. And right now, to avoid the congestions in the bank setups as they try to access this money, they are calling out on the government to send this money to them using their mobile phones. This is why.
Nikakuta pesa, nikaambiwa pesa iko kwa simu na simu yangu haina message. Sasa nikaambiwa ningoje ije ni message itaingia na ingie na pin. Sijaona, hata sijawahi ona kitu, lakini kutoka saa hiyo sasa ni saa kama saa 8 hivi na sijawahi kula chochote na wao hawajanipatia. Kwa hivyo sina tumaini lolote.
The banks have dedicated a staff member to help the elderly.
We've already made arrangements for them that they are able to get shelter outside the branch. Within the tents, we also have spaced the seats so that we maintain the social distance. And also we have provided the 2 washing points and also had the sanitizers.
Tumo karibu ile benki karibu na mimi. Niwekeo simu ini yangu. Hata kikwa vamia vanajua ati kuangalia. Taambia mtoto kaangalilia kama pesa inaingia hapa. Na ingefaidika.
It is not every household. We have 140,000 households. 140,000. It is 40,000 households who are the most needy. So it is possible that you are not on the list. And the reason is that you are not amongst the neediest.
Well, this is a viable reason they are giving, especially now that it was pointed out yesterday by the CAS for Health, Dr. Mercy Mwangangi, that even the banks need to be more careful to help curb the spread of COVID-19. And this is just some of the ways to reduce the crowding, even as they are looking for their stipend money. Let's head over to Mvita. And now the Mvita MP, Abdul Swamad Nasir, has donated 12 million shillings from the county CDF kitty to NHIF. He says during this trying time, it is only fair that the medical insurance covers people across the country, and this money will help to ensure that the people of Mvita and across the country have access to medical facilities with the aid of NHIF.
In Kenya, the insurance uptake and awareness is low. Only about 19% of the population is covered by insurance. So such steps as what has been done by Mheshimiwa will really help us increase insurance coverage.
Jambo hili ni muhimu sana, manake linalinga vile katiba yetu inavyosema. Katika Bill of Rights nasema kwamba kila mwananchi ana haki ya kupata afya bora.
Ya kwa takriban watu 10,000 katika eneo la Mvita, yani mtu pamoja na watoto wake, takriban watu 10,000 wataweza kusaidika na mpangilio huu. Na hii haitochagua wala kubagua. Ndani yake kuna mambo ikiwa kuna mambo ya x-ray, ikiwa kuna mambo ya presheni, ikiwa kuna mambo ya kibofu cha mkojo, yani mambo ya dialysis kuweza kufanywa, ikiwa ndani yake kuna mambo maradhi ambayo kwamba sote tunaomba Mwenyezi Mungu mtu yote asiweze kuyapata maradhi yote, lakini pia yakiwemo masala ya kansa ndo pia yamo.
Well, that has been the Mvita Member of Parliament, and he is helping people curb and deal with this pandemic. And talking of help, Remy Kipchirchir is saying it's about time that the rent bill and landlords be informed that they need to cater for the tenants in order to waiver the rent for the current situation in the land because of the COVID-19 pandemic. It is important that also for the government to cushion for the people with food and cut the cost of high prices that they are facing. Due to this fact, it is affecting those who have nothing to eat. Talking of the high prices of commodity and also on the issue of food. Thank you so much, Remy, for tuning in today. I can also see Zipporah Mololo. Asante for tuning in. Well, some countries have adopted to total lockdown. Some have adopted to partial lockdown, where we have people not moving from one county to another. And a good example is our country, whereby now we have 5 counties on partial lockdown. Well, what happens when these countries and these counties are put on lockdown? There is the curbing of the COVID-19 pandemic spread of that virus, but there is also the issue of hunger that comes with it. And right now, people are not only battling COVID-19. The tough economic times across the globe is causing people to be more frustrated, and others going to an extent of even lacking a meal. This happened in South Africa, where there is a story of a young man who is a foreigner in that country, and because of the tough times and not being able to get a license to sell his small things, because he's a trader, he's now forced to go sometimes a day without a meal. So here's the story.
Hungry people. These people are looking just for food. Please, I don't think Ramaphosa is doing something good. Why not? Then we can rather die of coronavirus than to die in our homes of hunger.
Because I'm an illegal immigrant, I cannot manage to get the permit to sell even this spinach. So that's why I decided to sell outside my building, so that even when the police they come, I easily run inside my building.
There were a lot of exclusions, such as undocumented migrants and people without existing trading permits. This is a problem because members of society who were already vulnerable before the lockdown are the ones who are now paying the highest price for the lockdown.
I'm buying here from my brother because we are all immigrants from Zimbabwe. It's really tough because there is no food. We are not working. We are trying to support each other. We are stuck here in this country. We cannot go back.
Could not even make enough money, so we're gonna manage only a little bit of porridge, because today it was no business.
Well, this is just a case study of what is happening in South Africa, but also as we talk about this and the tough times that we are having, there is another warning for famine. So imagine COVID-19, and apart from that, there is also famine. And this is a warning from the World Food Organization. And according to the executive director of World Food Program, that is David Basley, he's saying that about 130 million people might be facing famine and starvation along with the COVID-19 pandemic that is happening right now. He says because of the tough times that are being experienced in the country and also the issue of unstable economic status for different countries, it is exposing more people to hunger and famine. And even remember, in our country, we are still battling the issue of invasion of locusts. So when we combine COVID-19, locust invasion and famine, then it clearly is a statement that we need to stand in the gap, and the government needs to take up its position, because from the World Food Program, it is a situation that will cut across different countries, including, and it named some of the countries that might be more affected, including Yemen, the Democratic Republic of Congo, Afghanistan, Venezuela, Ethiopia, South Sudan, Syria, Nigeria, and also Haiti. These are some of the countries that will be affected so much, considering that 130 million people, that is a big number. In this case, we need to make preparations and stand in the gap, because it's not going to be easy according to the World Food Program. We're live on This Is The Day, live on Family TV, also live on Family Radio. And let us go to the USA, where the President Donald Trump has halted the immigration for the next 60 days. And he says these are just some of the measures that they are putting in place as the government to help reduce the high number of infections in that country. He says for the next 60 days, there will be no immigration cases in the USA. And after that, the government will decide on what next.
The enemy has inflicted a steep toll on the American workforce. As we all know, millions of Americans sacrificed their jobs in order to battle the virus and save the lives of our fellow citizens. We have a solemn duty to ensure these unemployed Americans regain their jobs and their livelihoods. Therefore, in order to protect American workers, I will be issuing a temporary suspension of immigration into the United States. You heard about that last night. By pausing immigration, we'll help put unemployed Americans first in line for jobs as America reopens. So important. It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad. We must first take care of the American worker, take care of the American worker. This pause will be in effect for 60 days, after which the need for any extension or modification will be evaluated by myself and a group of people based on economic conditions at the time. This order will only apply to individuals seeking a permanent residency. In other words, those receiving green cards, big factor, will not apply to those entering on a temporary basis. As we move forward, we'll examine what additional immigration-related measures should be put in place to protect U.S. workers. We want to protect our U.S. workers, and I think as we move forward, we will become more and more protective of them. This pause on new immigration will also help to conserve vital medical resources for American citizens. A short break from new immigration, depending on the time we're talking about, will protect the solvency of our healthcare system and provide relief to jobless Americans.
Imagine every day you are from work and you have to bring food for your loved ones and your family. I'm sorry for that. And for some reason during this time, you have to depend on the food banks to provide for your family the food and even sometimes the non-food items. That is what is happening in the US, and let us take a look at some of the food banks in the two areas, that is San Antonio in Texas and also Dayton in Ohio area.
Never imagined this, but I'm prepped to adapt in any situation. From what we're going through right now, it's been a big eye-opener and we're learning a lot. It's crazy. It really is.
Just move it on this side.
Among the country's 25 biggest cities, San Antonio has the highest percentage of people living in poverty, and that was before COVID-19. CEO Eric Cooper has worked in the industry for 25 years.
Normally, the food bank would feed about 60,000 people a week. That number jumped to 120,000 people a week. There's a lot of working poor families that are on the edge, and now the COVID-19 crisis has pushed them over that edge.
We just want to make them feel like home, like we're family. We just let them know it's fine, it's okay. And like I said earlier, I truly believe when we hit a bump, we're just going to get right back up. We don't judge.
We don't know. I'm anxious because I worry that because the demand is so high, our supply is inadequate, but our community is rallying, and that's what's inspiring me. I and many other food banks are making an appeal to our cities, our counties, our state, and the federal government that we need to be acting now to make sure no family in America goes hungry.
Good morning. Good morning. Did you want to get food? I do.
Absolutely. I mean, I know that will sustain, through the next few weeks, and that's a huge relief.
Anybody is welcome to come. We are actually expected to serve like 1,600 families today.
Well, despite the fact that their pandemic might be tough and these people have to queue for longer hours to get to this food, the food banks are helping the people of the United States of America. Now to some good news. Imagine you admitting your child for exhibiting some signs of COVID-19 to a hospital, and then you are told because of that child has Down syndrome, you only have 24 hours for him to leave, and after that, you can expect the worst. And 2 weeks down the line, your child is still safe, still alive. And to some good news, he's released from hospital because he has recovered from COVID-19. That is the story of one Ben McAfee. And the mother says there is no happier time that she has experienced other than this one.
Mum, that's Diane.
I'm Diane. Yes, I am. I am. Who are you?
Handsome man.
Handsome man. You are handsome man. What did you say? Did you hear me?
I don't know, just euphoria when he come out and he was chatting to everyone, and just to see him coming back out walking after the state he was in when they took him in, it was just wow.
I honestly expected him not to be moving, and I probably fell asleep for a few minutes and then woke up and put the mask on, so I didn't get much sleep. But when I said that was my first reaction, is he dead? And one of the doctors said realistically is only a 1 in 10 chance of survival.
As the week had gone by and it turned into the second week, I got a couple of phone calls and they said there was a glimmer of optimism, and they'd say a glimmer of optimism. There's no way he can go because he loves hats and wigs and music and dance. He's going to have a funeral like Nelson Mandela, so he won't die yet, I was telling myself, because it'll be a carnival when Ben goes. Everybody will have to go in fancy dress.
And what's it like to have him back in the house?
Oh, just, it's the glue in the family. Is as much as sometimes you think, oh, on a morning when you go in and he smiles, it's like sunshine. It's like, don't matter what sort of grey day it is, it's like sunshine. It's just sunshine.
And you've got that back?
I've got that back. In abundance.
And indeed, that is a mother's joy, knowing that your son, Your son, who actually the doctors say that he might not survive the next 24 hours, recovers from COVID-19. And considering the fact that at the moment, as per this hour, we have 706,000 people, 814 who have recovered from the COVID-19 pandemic, then that tells us one thing: there is hope. Even as people are dying, there is hope, because the numbers of those that have recovered are higher. So let's keep fighting. Thank you so much for tuning in to This Is the Day. My name is Sarah Otieno, and have yourself a lovely night. I will see you tomorrow.